Thank you so much for coming in to see us today.
Hi.
How are you?
Fine, thank you.
Wonderful. So I would like to look in the mirror together, and maybe you could tell me kind of what brought you in today and what bothers you.
Okay.
All right, so if you kind of hold this for me, tell me a little bit about what you notice in the mirror.
I want a fuller lip on the bottom, noticing a couple of wrinkles around the lip area. So mainly fuller in the bottom and minimize the wrinkles.
Okay, all right. Can you purse your lip for me? Like this, okay. Yeah, so you can actually see some of these lines all the way around the lip and relax. Definitely notice that your lower lip is a little less prominent than your upper lip. And we do want the lower lip to be a little bit more prominent.
Right.
And also in the corners of the lip, you can actually see these shadows in here. There are patients who are concerned with loss of volume and wrinkles around the lips. This is generally caused by, again, loss of elasticity and collagen, especially in the lip area. As we get older, just like our cheeks lose volume, so do our lips. Some of the fat cells around our mouth, some of the collagen, some of the fullness, some of the muscle tissue, everything gets thinner and weaker as we get older. So what women notice is that as they're applying their lipstick or as they're looking at their lips in the mirror, they're starting to see thinness, they're starting to see less of the pink of the lip showing, and they're also seeing the volume loss and the wrinkles showing around the edge of the lip. A lot of these are pretty typical aging process. As we lose elasticity in our skin, we lose collagen. You'll actually notice some of the lines forming around the lip. Usually in our 40s and 50s, we notice it more.
Okay.
Same thing with these marionette lines or oral commissures. Also, the volume loss in the lip is not uncommon also. There are some temporary home remedies. A lot of women will go to a local drugstore or a Sephora type store and they'll buy a lip plumper or a lip liner, and generally those are things that people can do at home to enhance the look of the lip. But many of these lip plumpers only last for a few hours and they generally don't have any good long-term effects. The treatment today, we're going to be using a hyaluronic acid gel filler to basically plump the lower lip and soften up a lot of these lines all the way around, and we'll use a little bit to fill in the shadows in the corners.
Perfect.
So the best treatment options for this category is actually the non-surgical. And in the non-surgical, it's all of our dermal filler categories. Our Restylane family, which includes regular Restylane, Refine, and Define, and also the Juvederm category, which is Ultra, Ultra Plus, and Velour. There is also a thin lip filler called Bellatero if people want a very subtle difference, and we also have a Restylane product which is very thin as well for people who want subtle, soft definition and a little bit of volume, and that product is called Restylane Silk. You ready?
I'm ready.
Okay, here we go. You're going to feel just a little pinch. We're going to soften up the lines as well as define the Cupid's bow. You can actually see the filler go right into the vermilion border, which is kind of that edge between the white skin and the pink skin of the lip. If you look really carefully, you can actually see more. You can see more of this lip because it's lifted, and you can actually see this lip is still curved down and curled in because it's dehydrated. So on the right side, we can do the same thing. We can kind of define our Cupid's bow and give a little bit of volume. And again, we're going to define our border, almost kind of like a clear lip liner. Another area that helps balance the lip and lower third of the mouth is this chin crease, which is not unusual to have at this age. So if we add just a little bit of filler right into it, it generally will soften up that shadow, make it look a little bit better. One of the reasons why this procedure is easily tolerated is because there's an anesthetic in this filler called lidocaine, which basically kind of numbs the lip as we go along, so it's not quite as painful as people expect it to be. More of a lip definition or a clear lip liner on the upper lip, very little volume because she already had a nice full upper lip. Got more volume on the lower lip to balance the fullness of the upper lip. And then we filled in kind of the shadows in the corners of the mouth. So it's normal for the lips to swell, usually for about 48 to 72 hours. There's a few things that help improve that. One is a topical arnica gel that we're going to apply now. It's an anti-bruising and swelling gel. The other thing you can do is ice it several times today and a few times tomorrow. That'll help bring the swelling down as well. Most people feel like it's not extreme. They can go to work the next day, and the numbing should wear off in about 90 minutes. So if you put the arnica gel on and ice a few times today and tomorrow, you really shouldn't notice a huge amount of swelling. It's not unusual to have a few little bruises around the edges of the mouth as well. Usually they're pretty small, but the ice and arnica will help with that as well.